we see many of these cyber incidents. For every one that you see in the headline, you probably have dozens that don't get picked up by reporters or that you don't see. So it certainly is a pretty scary world out there.
On this episode of the Phosphorus IoT Podcast, I'm joined by cybersecurity healthcare expert and consultant Josh Spencer. In this episode, Josh and I discuss HIPAA, connected device security, ransomware, and other issues associated with the healthcare cybersecurity field. I hope you enjoyed this episode. Hello and welcome to the Phosphorus IoT Security Podcast. I'm your host, Phillip Wylie. I'm a new host taking over the podcast for Phosphorus. And today I'm joined by one of my cybersecurity colleagues in the Dallas-Fort Worth area, Josh Spencer. He commented a high recommendation of another colleague I know from the area. So Josh has been gracious enough to join us today. And a lot of our focus is going to be around healthcare cybersecurity. So this has been a big issue. Lots of changes around HIPAA that we've got to stay up to date with. And so Josh is very experienced in this area. So Josh, if you wouldn't mind kicking it off, just kind of introduce yourself and share your background and kind of let the audience know kind of your experience in the healthcare field.
Yeah, certainly. And thanks for having me, Phillip. Really excited to get a chat with you. So my career in healthcare cybersecurity goes back, 15 years. So I started out earlier in my career as a certified ethical hacker. So it was my job to go in, act almost just like an attacker, hack into databases and medical systems and scoop up millions of records of patient data. But then would work with those health systems to understand, hey, this is how this is where you're vulnerable. This is how you can prevent the real bad guys from going out and stealing your data. And from there, continue to grow my technical skill set, moved into now technical program leadership and cybersecurity leadership at a number of large health systems. Have a huge passion for it, but it's been scary to see just increased risk every year, new threats coming out. So happy to chat about all the new technologies and what the bad guys are bringing to bear, but also some of the tools and techniques that the good guys have as well.
Yeah, from the healthcare background for the listeners, Josh was at UT Southwestern Medical Center for over 12 and a half years. So I would definitely say that you have to know something about cybersecurity. You were the CISO there and the CTO. So quite an amazing track record you have.
Oh, thank you.
So kind of one of the things to kick it off, I know because internally our chief product officer was really wanting to have someone on the show that could discuss some of the new changes and challenges with HIPAA. So if we kick off the episode kind of delving into that area.
Yeah, absolutely. We're seeing some changes, and I think with any new change, there's a lot of nervousness around what this could mean, a lot of bureaucracy, and a lot of big challenges to overcome to see any changes. And certainly, it's been very polarizing. So as I speak with my peers, hey, how do you feel about these changes? What do you like? What do you dislike? From the data that I've seen so far, and what will likely come out, I'm actually a big advocate for the changes that are coming out. I think many of them are overdue. One of the biggest criticisms of some of our current healthcare regulation is a lot of the gray area. But some organizations will do really well. They do what they should be doing, and some organizations really hide behind that ambiguity and say, no, we don't need things like encryption. So I really like what's being done to call out more concretely what is best practice, what is appropriate, what is not appropriate. So previously, certain things were more what HIPAA called addressable. They're now doing away with those and basically saying, no, these things are required. And it actually calls out very important things like you must have maps of your network. You must have an inventory of your assets and your data. You must have documented disaster recovery plans. Things that certainly we hope every organization would have, but as we see some of these headlines and some of these major breaches, you find that there's many organizations with, that patients come to a healthcare organization or they expect their data to be treated with a certain amount of care that we're seeing some of these organizations don't have it. I think that's a very important role that regulation can have to get everyone to where they need to be.
Yeah, that's good to hear. And hospitals have been such a huge target from ransomware, so the need to be secure and be able to prevent these type of attacks are very important.
Absolutely. Yeah, and it's scary because in healthcare we see, not just, hey, this one company got attacked with ransomware and, profits aren't going to be as up as much this year as next. What we see with breaches in healthcare, these medical record systems are down for multiple months. And so that means patients are they show up, you might not have access to their um, allergies, you might not have access to their medication lists, you might not know, blood types, things like that that can really delay care, or it's in many cases, people are even having to route to a further away hospital. So ambulances are having to turn around and go in a different direction because of this ransomware. There's been studies that show the mortality rates when these hospitals, health systems are infected by ransomware go way up. So yeah, you might see the headlines. Yes, this ransomware cost $100 million in damages, but the human factor is often dozens, if not hundreds, of patient deaths from some of these larger ransomwares. So yeah, it's a scary environment, but it definitely impresses upon us the need to implement some of the leading edge cybersecurity controls to keep that from happening to our organizations.
Yeah, it's scary when you think about the human risk like you're talking about. Then figure someone that's in the operating room or in the emergency room, and they need access to that data. That gets pretty scary.
Yeah, absolutely. And there's a case where a fetal monitor was infected by ransomware and didn't detect that, there is a umbilical cord wrapped around this baby's neck. And so, these really heart wrenching cases are coming out now, particularly as the bad guys start to realize exactly the huge stakes that we have in the healthcare industry. And it's basically, causing folks to pull out their pocketbook and pay these attackers these ransoms because it is so critical that we get these systems back online.
Yeah, I would imagine that's one area that the ransomwares do get paid because I mean you kind of figure the ransoms don't get paid the repercussions. So I can see they probably a high payout.
Yeah, and certainly the preference is we do as much preparation as we can beforehand to have things like backup or air gapped backups to where even if the attackers were to get in the system, you don't have a network cable connecting the data. So you've got a secure vault somewhere or secondary secure vault somewhere where no matter what happens, we hate to see these ransomware agents getting paid, these cyber criminal groups being paid because that just funds the next rounds of attacks. So I would love to live in a world where that industry dries up overnight and we say, hey, we've got technology in place to help keep the bad guys on the network, or if they do, where we can restore from backup. Because currently the way the industry is going, it's causing all kinds of devastation. It's creating this industry that we really can't have out there.
Yeah, and it's really scary when you mentioned that, like the fetal monitor, some of these connected devices that are in these environments. Because Phosphorus, we have a solution for IoT and OT security and help protect these connected devices. So it's really kind of scary, in a industrial setting, people can still get injured, or there could be loss of revenue because manufacturing is taking down and people could get injured. But when you think about hospital, how directly that affects and some of the innocent lives that can be affected by these type of attacks.
Yeah, absolutely. And I have conversations at least on a weekly basis with some of the largest medical device manufacturers and their teams. And oftentimes they will say, hey, it is such a bureaucratic process to get through certifying these devices for patient care. They just don't have time to do things like security updates or to harden their system against the latest threats. So that's where, in many cases, we fight that battle. And there's certainly ways for these large medical device manufacturers to do things right. But that's often where we have to implement compensating controls. So we can say, okay, if this device is only going to get critical patches on a quarterly basis, maybe instead of a monthly or an instantaneous basis, that's where we say, hey, how can we segment this device, from the threats out there? How can we make sure that it is isolated as a really solid compensating control to keep it protected through really a defense and depth approach that definitely leverages segmentation, zero trust, and those types of technologies.
Yeah, definitely better to use mitigating controls than risk acceptance because I come from a pen testing background and getting these risk acceptances sometimes, and then thinking of the connected devices. Back when I was pen testing, I did some Wi-Fi pen tests to hospitals, and it's kind of scary to see some of these things connected to the Wi-Fi network.
Yeah, yeah, it is. It's definitely a scary world out there, and part of the problem is, in a hospital environment, as we walk through, everyone's phone can have a wireless hotspot on there? How do we know if that's a patient who's just trying to get out and to stream some game somewhere versus, oh, this is an attacker who's trying to burrow in, assess the environment, set up a fake hotspot to try to capture patients' data. That's where, yeah, we definitely have to leverage a suite of technologies, anything from, hey, end user education or informing our folks what to do, all the way to technologies that basically alert the security team that, hey, you've got a persistent device over here that is looking to impersonate the hospital's Wi-Fi, or do other things that could be very suspicious and warrant some of our follow-up action.
Yeah. So, what are some other type of steps folks could use to protect their connected devices, like their medical devices?
Protecting devices, much of that is staying aware of what the current recalls, vulnerabilities are. So many times the manufacturer will put out notices. A lot of times it's just understanding, okay, we've got this notice, we've got this vulnerability. Let's understand what the real world risk is. Some of these are very theoretical risks that yes, we should get around to it. And some of them are very real world. Hey, instantly you need to go, you need to disconnect systems or you need to apply patches. So a lot of those are going to be case by case. But there's also a lot of best practices. So if you've got medical devices with exposed USB ports where a patient could reach up and they might just be interested in plugging in a device because they need to charge it and not realizing that might actually be a vector for something to compromise that particular device or for folks to get curious about what certain things do. Things like hardware, USB blockers, segmentation on the network, very important, as well as keeping those devices up to date with good patches, and then also having the network monitoring in place to understand, hey, you've got a medical device and it's connecting to maybe Siemens and it's getting some updates from its operating system, but then noticing, hey, all of a sudden, why is it starting to try to connect to somewhere, a foreign country that we don't do business with, and why is it trying to send large amounts of data out there? Having the analytics to detect those types of things so that we can have the health systems, their clinical engineering teams, or their cybersecurity IOMT teams do a little bit more digging, investigate, and figure out what needs to be done to protect that device.
Yeah, that's interesting that you mentioned patients or people within the hospital trying to connect chargers. That's one of the things that I never really thought about that could definitely see being a problem, someone connecting something and not know that they're infected by malware or something.
Yeah, or some of them might want to be friendly, and hey, they found this USB stick at a parking lot somewhere, and I'm going to bring it in and see if I can help it get it back to its owner, not realizing that, oh, okay, this thing's now infected, even intentionally or unintentionally with malware that could then try to spread throughout the network.
So yeah, one of the things too that I really like about your background, because I come from pen testing as well, is just the fact that you have that background. Because in my opinion, I think it's kind of important to have someone on staff like that, because when you understand what the threat actor thinks like, then you're able to protect things. Because when you mentioned the USB stick, someone that's worked in security, especially on the offensive security side, you see a USB stick laying on the ground, first thing you think is it's malware or something. You don't think it's normal. It's kind of like that whole thing. If your hammer, everything looks like a nail. Once you've had that hacker mindset, it's kind of hard to undo.
Absolutely, absolutely. And we've seen a big trend in healthcare. Oftentimes you have folks come in with more of an audit or a compliance background and yeah, okay, everything needs to be fixed. I think one of the big disservices that many even cybersecurity experts will do is they'll take an approach, almost an entirely compliance-based approach versus that what is the real world risk? What are the things that yes, ultimately we should get done, versus the things that, hey, this is an actively exploited thing that is spreading all over the internet that we need to act now, and adding that lens to how you look at problems. And oftentimes, yes, by bringing in those seasoned expert pen testers, the people that really have their fingers in what's going on, and know what the real world risks are, versus a theoretical. We see a program that's able to operate with a lot less risk and a lot more agility.
Are you seeing more hospitals kind of understanding that pen testing needs to be done? Are you seeing more adoption?
Yes, yes, and I think, yeah, particularly with the headlines. So I hate to see major headlines of major cybersecurity incidents, but at the same time, I do enjoy that at least brings attention to the problem, because we see many of these cyber incidents. for every one that you see in the headline, you probably have dozens that don't get picked up by reporters or that you don't see. So it certainly is a pretty scary world out there.
Yeah, kind of back to the HIPAA thing too. It seems like, a lot of people take compliance as kind of a checkbox type of thing. So hopefully with, these ransomwares and all this, that people are starting to take it seriously and beyond just the checkbox, because just because you're compliant or some audit firm says you're compliant to this, just being compliant doesn't mean you're secure. What are your thoughts on that?
Yeah, absolutely. So, yeah, technical compliance will only get you so far. A big part of having an effective compliance program is matching the technicals with your actual protocols that are in place as well as a culture. So, an organization that is being vigilant about the things that they do, if they see something suspicious or see something off, will go a long way to keeping you resilient against many different threats out there. So we've seen many times that technical controls have failed, but major breaches, major incidents have been stopped because the user said, "Oh wait, this doesn't quite seem right." Or as we do really after incident and investigations of some of these breaches, we find in the vast majority of cases there was an opportunity for a person to recognize that, hey, this doesn't quite seem right. Yeah, why am I getting this email from someone's personal email address, or why are they texting me instead of sending me an email? So many of these cases, the vast majority of them, a human could have detected it somewhere in that chain and prevented it. So that's why having a big investment into tools and technology is very important, but also making sure that those are incorporated in your processes and that people are aware of what they need to be doing. Because we see a lot of times cybersecurity teams will put in the best of the best technology, but they won't work with the business to understand, hey, how is this going to impact your operations? Is this going to work well? How do we have a solution that still lets you get what you need to do at the end of the day done? And that will often drive people to shadow IT, or basically hey, I can't use our cloud storage solution because it's too secure, and I can't work it at all, so therefore I'm just going to go out and sign up for a Dropbox account and put all of our data here because I can share it easier. That's definitely the balance that we have to walk of making sure we've got a very secure pieces of technology that we're officially offering, but are working with the business to make sure that it's workable and we don't drive shadow IT.
Yeah. So what about security awareness in healthcare? Because that seems like kind of a difficult, because you got, nurses, doctors and stuff that they're busy, and when do they find time or sit down to do this? So does security awareness seem to be a challenge in the healthcare field?
Yeah, absolutely, and I can certainly see why. So I've sat through probably at least a dozen different healthcare organizations cybersecurity training, and I'll say most of them were looking at the class, half of them were asleep, checking emails, not paying attention. I think a lot of it is so dry, and it's basically reading out the compliance regulations. I've seen a number of organizations that do things very well when they start out with, "Hey, here's exactly why it's important for you to know these things," and can tell some stories about, both the good where things are saved, but also where people's minor negligence or, "Oop, I didn't think about clicking on this email or putting in my password," where that can lead to, thousands or millions of patients' lives being devastated because now they're lifelong victims of identity theft. So having that high quality training that really ties what they should be doing with why they should be doing it is very important. And then not just many organizations will give you your new hire training and then say, "Okay, we're done with it," or we'll show you some slides every year. An effective program is going to periodically throughout the year bring those risks to mind. So one common strategy is like the phishing emails, where what many organizations will do is they'll say, "Hey, this organization got hit by maybe 10 different high profile phishing campaigns. Let's figure out what the common elements are so we can get some training out there, and if someone does click on the bad link, let's give them some hold their hand. Let's let the understand what they did wrong, how they can spot those types of issues in the future, and help the program be much more robust." Or things like, "Hey, we noticed you've just sent a lot of potentially protected health information out to ChatGPT. Here's our policy on this. Here's some secure alternatives for you to use," and things like that as you see it. Or like, hey, we noticed you plugged in an unencrypted USB stick to this computer. We blocked it, but here's a policy. Here's how you can get an encrypted device, or here's how you can send data securely. We've seen those types of really real-time interactions with our end users be much, much more effective than trying to give them an hour of training every year that they're probably going to sleep through most of it.
Yeah, and one of the things I'd like to see too, because some companies, because I've some fellow pen testers and myself have done social engineering engagements and phishing, and someone gets phished or someone gets, is a victim of a physical pen test and they kind of get punished. One of the things I think is helpful, I'd like to see is more of a reward, because if you reward people, they're going to try that, because it seems like if someone clicked on a phishing email or did something they didn't, and you have more of the disciplinarian approach to it, people are going to be scared to let you know. But if you reward people for finding things or seeing things suspicious, you kind of build that culture of security.
Yeah, absolutely. And certainly where we can see that cybersecurity awareness training and recognition tie into maybe broader organizational recognition. So I've seen one organization does a really great job of this, where they basically they have a HR site where you can earn points throughout the year and recognition as an employee engagement program. And then at the end of the year, you can spend those points on coffee mugs or T-shirts or things like that, or give them to your peers. Where they've implemented a program where, hey, if you report a phishing email successfully, then you're going to get these points that you can then spend, and definitely they get the acknowledgement on a wall of fame and things like that. That really encourages folks to be ever vigilant and almost kind of gamify some of their spotting these attackers.
I love that. And when people pay attention to those things, it's going to help them at home too, where some of these devices, if they got a bring your own device policy and people are using these devices outside of work, not using them safely, those habits are going to be brought into the workplace. So I like that method.
Yeah, absolutely, and particularly as we see this blending of the bring your own device, and the industry really changing from this, nope, hey, you're going to have your company phone and your personal phone. Still a lot of that, but we're starting to see more technologies like mobile application management, where we can enforce security controls on your particular, just particular applications. But that's really driving up the need for you to have all of those devices be as protected as possible and follow good hygiene, both in your workplace as well as your home.
Yeah, just that you brought up Chat GPT a while ago, and before we started the podcast recording, you mentioned AI. So what are some of the things you're seeing out there security wise, and what are some of your recommendations on securely using AI?
Yeah, yeah. So certainly it's a huge risk, both in terms of what the attackers are doing and how that's changing some of our threat landscape, as well as how our end users are exposing our data, either knowingly or unknowingly. We've helped some organizations go through assessments where we basically put in technology and we say, hey, over the last 24 hours, here's all of the sensitive data that went to ChatGPT or Claude or you name it. And every single time we do that assessment, the teams are always shocked at how much data are out there, because you assume there's going to be some vigilance or awareness that, hey, we don't have these HIPAA agreements with ChatGPT, so inappropriate for this data. From speaking with some of those offenders, really dozens of offenders over the past couple years, some folks are, hey, I didn't know, or I didn't think that was identifiable. But I've even had some shocking conversations where they say, I don't care. They say this technology is so powerful that I believe it's in the best interest of these patients if I basically breach their data to be able to use these technologies. So that's where organizations really need to be looking at what are secure ways of delivering this technology, because it's doing amazing transformative things, but there's certainly a right way and a wrong way to do that.
So as far as like using AI, so how are you leveraging it yourself and your consultancy?
Mhm. Yeah. So we use it all day, every day. So we've seen really an incredible capability to give our junior security analysts the ability to say, yeah, hey, I see this strange log in a computer system, whereas normally they would have had to reach out to a senior engineer, do a whole lot of research. They can very quickly in the moment say, hey, AI, what are you seeing with this? Is there anything that should concern me? And in a few seconds back, get, oh yes, right here we see this, this very suspicious log going here. Hey, check this. Hey, look to see if this is an issue. and is letting them triage issues with not just much more speed, but also much higher quality detections that we would have otherwise missed. So everything from there to, we have very technical, brilliant minds that oftentimes they know the technology, but some of that can be lost when they're speaking to an executive who might not understand the geek speak. So that's where we've seen a tremendous amount of success by basically saying, "Hey, go ahead and give us your technical story of what exactly happened." With this AI, you can give it, "Hey, here's a dozen different email threads. Hey, here's the documentation. Here's the RCA," and you can very quickly with this generative AI say, "Write this in a summary for my CIO." With these security recommendations, and now just a matter of seconds, you can have a very drafted up a very clear, concise message that all of these non-technical stakeholders can now understand much more deeply some of these very technical cybersecurity risks.
You mentioned that subject, just the communicating with the business. What kind of lessons have you learned, and what recommendations can you make to practitioners and security folks to be able to communicate with the business units and upper management?
Yeah. So I certainly think it's going to depend on and really depend on you knowing your audience. So if you're speaking with a CFO, many times it's trying to the extent that you can break down, hey, these are the financial costs of these are the risks. Hey, we've got this percent likelihood of this event happening. Hey, our similarly sized peer, had this happen 3 years ago and it cost them X millions of dollars. Those types of things we see very successful versus some organizations, you might be dealing with a leader that's very reputationally focused. So to be able to say, hey, we have the exact same vulnerability as this organization. And 6 months ago, here's the newspaper headline that had them really embarrassed, type of a thing. So knowing your organization, or even going back to the AI piece of having the AI help coach you for how do you have more effective conversations and how do you more clearly, more effectively communicate these things to leadership, um, allows you to have just some amazing results and get a lot of traction with your security initiative.
So, what are your top recommendations for folks in healthcare cybersecurity?
So definitely, if you're in healthcare cybersecurity, you're in a good place. Certainly, lots of change coming up. So I'd say buckle yourself in. But more important now than ever to realize that the threats are escalating at a very quick pace. So we're seeing all these really great things I mentioned, what AI can do for our cybersecurity analysts and the good guys, but we're seeing rapid evolution of new threats from the bad guys too. So becoming more important than ever, get plugged into industry updates, what new threats are coming out, how do we mitigate it, what new tools and technologies are there, what new best practices are there. Because we see a lot of organizations that come in and they just become dated or lack some of these technical skill sets that otherwise, other teams were able to leverage much more effectively, and they're kind of getting left in the dust.
Yeah, it's great advice. It's just crazy with AI, the way things are evolving. Not only helps us, helps the threat actors. I mean, like phishing emails are getting more are improving because of grammar. Some of these nation states or threat actors aren't English is not their first language, and then even some cases you take people that speak English, they don't properly write and use English and grammar properly because working in IT and security for many years, you kind of see that someone that even with college degrees not properly communicating.
Yeah, and a lot of the red flags that we used to tell people to look out for some of the emails no longer exist because now the attacker can go in. There are specially developed AI models that are designed to do nothing but generate phishing email or generate viruses, malicious code, things like that are out there. We've even been seeing a lot of tailored phishing emails to that individual person that will scan your LinkedIn account, that will scan your online web presence and be able to mention things about your history that makes it seem like, oh yeah, I know this person or this person's real, or has a real scenario in mind when it's really just an AI bot that's trying to get into your environment or get you to do something that you shouldn't be doing.
Yeah, very scary times, but good to see that the good guys are learning how to use AI. Well, thanks for taking time out of your busy schedule. It was a pleasure to virtually meet you and have you on the podcast.
Oh, likewise, great chatting with you. Thanks, Phil.
Thanks, everyone, and we'll see you in the next episode of the Phosphorus IoT Podcast. If you want more information on Phosphorus, go to the Phosphorus website at phosphorus.io. to learn how we can better help you secure your OT and IoT environment. Thanks.